Hi, this is Dr. Vijay. I'm one of the doctors with the OakBend Heart and Vascular Group. We are going to be talking about heart attack today. For first 3 minutes is question and answers, and then we are going to go inside and see how a heart catheterization procedure is done. We can go to the questions. We got like few questions here.
Why are we talking about heart attack?
This is an important question. This is the first question my wife asked. You know, when your wife asks, you give priority to the question. It's always good for your overall health. But the reason why we are talking about heart attack today is this is the heart disease is the #1 killer in the country, and in many places of the world. Nearly half of our heart-related deaths are secondary to heart attacks. In our country alone, every 43 seconds, one person is having heart attack. Think how much the burden is. So we want to take this to the community and spread our education about heart diseases. That's the reason for this presentation.
What exactly is a heart attack?
So you all would have seen or heard about heart attacks. So this is how a heart looks. This is on the left side of the chest. Although the heart is filled with blood, heart is a muscle. It gets blood supply through the coronary arteries which run on the top. It does not get oxygen and nutrients from inside. So one of these arteries get blocked, we get heart attacks.
What's the difference between heart attack, heart failure, and cardiac arrest?
So this is a question where everybody gets confused with. Heart attack is the one we are talking about. That means when one of the heart arteries get blocked, the heart muscle, which gets blood supply from that artery, doesn't get any more oxygen. It could get damaged and eventually die. That's a heart attack. Heart failure is when the heart muscles get weakened. Every heartbeat, the heart pumps 55 to 60% of blood it's get from within. If that heart is not pumping 55%, the heart muscles are weak and we call it as heart failure. Cardiac arrest is completely different. When the heart completely stops, that means if somebody is dead or dying, that's cardiac arrest. If you do not restart the heart within a minute or like few minutes, the patient could eventually die.
What are common risk factors for developing heart attack?
So common risk factors are age, gender. Males are more prone to develop heart attack. The other modifiable risk factors are diabetes, high blood pressure, smoking, and high cholesterol. Family history is an important risk factor too. There are other rarer things like somebody's doing some drugs or like kidney disease. Those increase the risk of heart attack too.
How do I know I'm having a heart attack?
The most common symptom or the classical symptom is chest pain, or sometimes it's felt as a pressure in the middle of the chest which goes to your neck, jaw, or shoulders. But this is not happening in all the patients. Approximately 5 to 10% of patients could have atypical symptoms, which is shortness of breath, extreme fatigue. This kind of atypical symptoms are more common in females, elderly people, and people who have got long-standing diabetes.
What is the difference between major and minor heart attack?
So this classification is more important to the medical field. Major heart attack happens when the artery is 100% blocked. The minor heart attacks happens when the artery is somewhere between 70 to 95% blocked. What makes the difference is when the heart artery is 100% blocked, the muscles getting supplied by the heart artery dies within few hours. So in those situations, we need to open the heart artery back up within 90 minutes. Here in OakBend, we are equipped to do that all 24/7. So anytime you present in the morning 8 o'clock or you present at midnight or 2 a.m. in the morning, we will open your heart artery within 90 minutes.
What should I do if I develop symptoms of heart attack?
The first thing you should do is call 911. Do not wait for anything. Do not try to drive yourself to the hospital, and we don't even recommend your family members driving to the hospital. If you are after calling 911, if you have aspirin at home, take 4 baby aspirins or 1 big aspirin, try to chew it and then swallow it. If somebody who already have got heart disease, you could take a nitroglycerin pill. The nitroglycerin pill you put it under your tongue, 1 pill every 5 minutes for a maximum of 3. But the 911 the EMS should bring you to the hospital.
And what does the ED or EMS do for someone who's having a heart attack?
So first time when the ED or when you walk into ED or when you come to EMS, what we do is we check your vitals, heart rate, blood pressure, oxygen saturation to make sure you are stable. Once that part is done, we get an EKG. EKG is an heart tracing, which is like this. We put in leads on your chest and then we show, that will show whether you are having a major heart attack or a minor heart attack. If this comes as a major heart attack, we bring you to the heart catheterization lab immediately. Then we move quick. If it is a minor heart attack, we got a few hours to take care of it.
Okay, and what happens in the heart catheterization lab?
This is the interesting part. Now we are going to go into the heart catheterization lab and see how things are. And here is our team. Susie, our nurse, and Mike is our technologist. We all work together in taking care of the patients with major heart attacks and minor heart attacks too. So this is not a patient really, it's a mannequin. So we just set it up for this purpose. So I am usually like Mike, sterile, like scrubbed into a sterile suit. Today we can't do that. So when the patient is on the table, we first get something called an access. We could go through either the right wrist artery or we could go through a femoral artery in the groin. So we take a needle, it's called a micropuncture needle, a small, it's long but it's very tiny needle. We put that needle in the leg artery and then pass in a wire through that artery, and then we put in something called a sheath. It's a plastic tube which goes into the artery, and then this comes out, this stays within the artery. This gives us access to go into the heart. Then once we have access to the heart, we take catheters, which is like, like spaghetti sized catheters which flex, bend. We pass these catheters through the sheath into the heart artery. So this catheters will go through the sheath and then we can pass it into the heart and then inject some contrast through the back portion of the catheters and take pictures. When we are taking pictures, the pictures look like this. So you see, this is a person who we did recently, all the names and everything are erased. You could see this is the right coronary artery. The artery fills up and then it's supposed to go fully and it gets blocked here. You want to go to the last one. So what we do is we pass in wires into the heart and then we take some balloons and like we put in a stent. This is a stent, heart stent. It may be really difficult to see on this view. I'm going to like make it, you may be able to see it better now. It's really tiny. The heart arteries are less than half a centimeter. So we use a balloon to blow it up. Mike is going to try and show whether we can blow this up. You could see it enlarging. This is what happens within the heart artery. So this stent pushes the blockages to the heart artery and then the balloon can come out. The stent stays within the heart. So this is what we did to our patient and this is the final result. You could see the artery was like blocked here. There was no blood flow to this whole part of the heart. Once you open up into the stent, there is good blood flow to all this heart. So that's the heart attack solved. Or there could have been like minimal damage to heart muscles, but we opened it up.
And what do we do after placing a stent?
So after we place a stent, we close the groin. We have got like modern devices like to put a stitch from within. And then we move the patient to a recovery area or a cardiac intensive care unit where the patient stays there for overnight. We make sure there is no major cardiac problems and then they get discharged next day. But they need to be on blood thinners called aspirin and Plavix or Brulanta or Effient for 1 year. And they're not supposed to lift anything heavy, and we need to work together with you all to make sure the heart attack doesn't happen again. So that's what usually happens. And I think we are close to a talk. Thank you everyone. It's a great pleasure to talk to you all through this. If there is any questions, feel free to contact us through email. My phone number and office number would be on the bottom of this message. or reach out to us through Facebook. Have a nice day. Thank you.